It's my pleasure to introduce a colleague of mine from the University of Wisconsin, Dr. Jonathan Patz, who is the director of the Global Health Institute at the University of Wisconsin. He also wears multiple hats, as many in the environment do in Wisconsin, and he is professor in the John P. Horton Chair in Health and the Environment, with appointments in the Nelson Institute for Environmental Studies and the Department of Population Health Sciences. And he has the challenge today of, in about a half hour, giving us setting the stage for the discussions we're subsequently going to have and the presentations on what's going on and what can be accomplished at the local community level. So, Jonathan.
Andy, thank you very much for your introduction and for the invitation, and it's great to be here presenting on this. And I wanted to just reemphasize that it's so exciting that the American Public Health Association is claiming this year to be the year of climate change and health with the big conference at the end in November. So everyone, this is great that we're having this at the National Academy of Sciences, this conference. So I'm going to be setting the stage, and I'm going to talk about climate change as both a major health risk, but actions against climate change as a huge opportunity for health. Now these maps you've seen before. This is from the latest UN IPCC report, the Intergovernmental Panel on Climate Change, and you can see the range of warming from on the left, sort of a low emissions scenario of and results in 1 degree warming by the end of the century, and the business as usual right now is on the right side, that we could see a warming of 7 or 8 degrees centigrade on average across the world. Now, what does that mean for health? This is why we're here. The so what, and the so what is that there are all of these different health outcomes that are highly climate sensitive. And I won't belabor this slide because you've seen all of these. You're aware of the heat waves, the air pollution issues, and allergen issues, infectious diseases, especially those carried by insect vectors, vector-borne diseases, waterborne diseases. If we're thinking about extremes of the water cycle, hydrologic extremes, that means not only more droughts, but more flooding. It means giant blizzards and snowstorms. That's a hydrologic extreme. This year we've seen extreme temperatures in February. The consecutive hot days in February is a record. And now we have a big blizzard, and of course it's hydrologic extremes. It's not just warming temperatures. Sea level rise being the third attribute. So these attributes will cut across all sorts of health outcomes that we know are climate sensitive. And of course, our health depends on adequate food and water supplies. The bottom one, mental health and environmental refugees, very difficult to attribute to a climatic event. But I think that if you consider droughts and forced population movement or sea level rise and retreat from coastal settlements, that this issue could, in fact, be the iceberg under the tip of the iceberg as far as the extent of impact. Now, new things arise every day, and there are some studies out of Southeast Asia showing that with sea level rise and salination of freshwater aquifers, there's an increase in hypertension and preeclampsia. Who would have thought? So I want to just talk about one example of something that we experience and we know is a major health issue. In New York City, right now, there are about 13 days that are 90 degrees or hotter. But from our downscaled climate modeling for this region, that number will triple from 13 days to 39 days. And that tripling in very hot days holds for about all the eastern cities that we've looked at. So this is a major concern, and we know that people die in heat waves. Another big issue with heat is that heat damages crops. And if you look at this model of future heat waves, you can see everything in red down here has a 90% probability or greater of having the hottest summers they've ever experienced. And what that means for malnutrition is that you could see a doubling in the number of people at risk for hunger by the end of the century or by mid-century. That's a huge public health issue and concern. I'm going to drink all my water here because this cup is leaking. So, okay. Now, so the bad news with crops being damaged, you know, the other bad news is that there are some plants that may thrive with higher CO2 and warmer temperatures. And this is a study led by Lou Ziska and is in the U.S. National Climate Assessment that John Balbus at NIH has really spearheaded. And this is showing how in the last few decades, the extent of pollen season, this is looking at ragweed pollen season, has been increasing. This is showing how much longer that is. So if any children have asthma, they're at higher risk for a longer period of time. So Georges mentioned Zika virus, and this is a paper that came out just a couple of months ago showing that, in fact, just the period 2015 to 16, the risk for transmission of Zika was the highest that it has been in over 60 years. This is a climate model looking at climate suitability for the Aedes aegypti mosquito to transmit Zika. Look how high that was. And it's not a surprise. If you look at studies of Zika virus in Southeast Asia, of dengue fever, oh, wow, look at all this. This is hydrologic extremes now. 2 glasses of water and 1 puddle. Okay, so dengue fever and Zika are very similar. The same virus family, the same mosquito vector. And if you look at a place like Southeast Asia, where dengue fever happens every year, it's fairly seasonal. And you can expect when dengue fever is going to peak. But in looking at this 18-year record of dengue fever, there were a couple years that really lit up as major epidemics, those red years. Those red years happen to be coincident with these very strong El Nino events. In fact, 1997 is the strongest El Nino we've had in recent history until 2015, which was equally as strong as 1997 and lasting longer. And we've been looking at what this El Nino did for temperatures across South America and find that the hot temperatures were unprecedented. So we are, it's not all climate, and we know there's an international travel component here, but to the extent that we understand dengue fever ecology and its relationship with drought and with extreme temperatures, I would venture to guess that strong El Nino had at least something to do with the Zika emergence in South America. Now, of course, remember, it's not just global warming, it's also extremes in the hydrologic cycle. And so according to the U.S. Global Change Research Program, in the future, when it rains, it will pour because hot air holds more moisture. So when it rains, it can rain really hard. So this is something that affects public health when you think about water contamination. Washington, D.C. is subjected to combined sewage overflow events This happens when it rains too hard and the systems don't handle the stormwater well enough, and so we get these combined sewage overflow events. We've done an analysis for the Chicago area and found that there would be a doubling in combined sewage overflow events because of the increases in extreme rainfall and runoff. Now, this may be hard to see in the back, but I'll just tell you that this is the situation in Syria as far as decreasing rainfall, increasing temperature here, and a drought index that is showing extreme drought. In fact, before the Civil War in Syria, they had the most severe drought in the instrumental record. And of course, civil war led to hundreds of thousands dead and millions of refugees. Now, this is something that you can't blame on that event, but to the extent that we know that migration from rural to urban locations in Syria was 3 to 4 times its normal level. Food prices went through the roof, and there was civil unrest. How much had to do with the extreme environment? It's hard to say, but it's these indirect effects that could be destabilizing, that could be enormous, and yet very hard to pinpoint. And this is one reason why President Obama talked about climate change as a national security threat. And he changed the frame of climate change. As Georges was saying, it's not just the polar bears, it's not just an environmental problem. In this case, it's a national security problem. And other people have looked at changing the frame of climate change. The Pope Francis effect, talking about climate change as a moral issue. And this conference talks about health equity, and Dr. Benjamin talked about that is a priority. It's been a priority for APHA for a long time. But climate change is a moral issue. We published this cartogram 10 years ago now, and what it shows is that on the top you see countries that are putting out the most CO2, and this is looking at a 50-year aggregate. And the United States is the #1 most responsible country for today's climate change, even though China now has surpassed us with emissions. Now, is Africa responsible for cranking out CO2? Not much. But where do we see the most climate-sensitive diseases? Malaria, malnutrition, diarrheal disease. You see these sub-Saharan Africa and India, these are places that will have the most impact at first. But of course, in a globalized world, increase in disease anywhere in the world affects everyone. But this is something that this is a big ethical dilemma. When you look at Americans emitting 6 times the global average CO2 per person compared to the rest of the world. Now, I had the good fortune to show that map to His Holiness the Dalai Lama, and he's a smart guy, and he asked me point blank, he said, "Jonathan, if you know pollution kills, your country is not showing much compassion, correct?" And I thought about that, and I told him, we didn't know about air pollution until 1952, the killer London smog event, and it's just in the 90s that we understood climate change. And he looked at me, he said, "Well, it's 20 years later, and you're still cranking away, polluting and killing people around the world with your energy policies." So with that, I turn the page because we are in a new era of awareness. And the Framework Convention on Climate Change that occurred in Paris, the Conference of the Parties of that framework, was a turning point. That conference had a record number of heads of state, 143 heads of state. That's a record number. And 183 countries came with commitments to reduce greenhouse gas emissions. It's big commitments. The U.S. came in at 28% reduction, EU at 40% reduction in emissions by the year 2030. These are big commitments. But even with those big commitments, the blue line is no action. The red line are those big commitments to reduce greenhouse gases and ratchet them down quickly in the next 15 to 20 years. But that will still only get us to about 3.5 degrees centigrade warming. And the impact scientists that have been looking at this for a long time have been warning us to stay below 2 degrees centigrade before we have catastrophic problems and ecosystem collapse. And so the idea is to ratchet down and get to that level. So we need immediate and substantial actions. How will we get these? This is where this conference comes into play, because I would argue the importance of climate change in the health frame, because public health is a core issue and a core concern with climate change. But I would also argue that policy to combat climate change could be free, and with public health co-benefits from climate change policy, especially in non-communicable diseases, the chronic diseases like heart disease and cancer, that we could have a net gain, a benefit from climate change policy. And I think the opportunities are especially across these sectors. And George just mentioned the health in all policies approach. And I would argue that energy policy is public health policy. Food systems policy is certainly public health policy. Transportation and urban planning is health policy. This is a slide you probably have seen before from the World Health Organization, seeing the numbers of people, the more than 3 million people that die prematurely every year from urban air pollution. More than 4 million people die from indoor air pollution. This MIT study that just came out a couple years ago now, asked the question, what if we had a cleaner energy system in the United States, more renewables? What would the health side benefit or co-benefit be from reduced PM 2.5 and reduced ozone? Remember, when you burn fossil fuels, not only do you get greenhouse gas emissions, you get all the nasty pollutants that kill people right away, or at least in the near term, from PM 2.5, ozone, nitrogen dioxide, sulfur dioxide. So from the reduction in PM 2.5 and ozone that would occur from a cleaner energy society, I'll just quote from the abstract here, that the health benefits could offset that upfront investment in energy between 26 to 1,050%. In other words, the health benefits could be up to 10-fold greater than the economic costs in the upfront investment in green technology. And this is something that the policymakers need to understand when you're thinking about the cost of a cleaner energy system. You know, how much would it cost to remove 1 ton of CO2 from the atmosphere? It might be upwards of $30 in better technology, solar, wind. But notice this is only half of the slide, because what happens when you take a ton of CO2 out of the air, you also take a lot of PM 2.5 and the other pollutants out, such that the benefit, the health benefit from cleaner energy could average $200 for every ton of CO2. And for those of you listening to this, I mean, I think this is where policymakers need to understand that, and you need to ask them this question: which number is bigger? Because they're really only looking at this upfront investment. Well, we don't want to pay more for cleaner energy, when in fact there are huge gains to be had. And especially if you live in very polluted countries, in East Asia, your benefit could be much bigger than this. And the cost might not even be $30 per ton anymore. Look at the cost of solar energy. In 40 years, solar energy dropped in price by 99%. Now, China gets this. This is the president of China, knowing his air pollution problems, and also knowing about solar. China's, they're hedging their bets, and they're the #1 producer of solar panels now. They do have a coal-fired power plant problem, but just recently they decided not to go forward with another, I think, 80 or 90 coal-fired power plants. They scrapped that plan. So China is moving forward, and China is talking about backing the Paris Agreement. Even if the United States backs out, China is going to be moving forward. Another area where we have considerable co-benefits from environmental policies is in food and agriculture. And I don't know if you can read that in the back, this cow. I am full of greenhouse gas. Do you have a stake in it? I took this picture during the climate summit when I was marching with my mother, my 88-year-old mother at the time, down in New York City. So this is something that many of us already recognize, that eating lower on the food chain is better for the environment and better for our health. If you compare high meat diet to low meat diet, fish diet, vegetarian and vegan, this is looking at carbon dioxide equivalents, so the amount of energy and fossil fuels that go into producing those kilograms of protein. You can see eating lower on the food chain is much better for the environment, but it's also better for our health. This is a study out of the UK showing that if they half the meat consumption, the greenhouse gases would be reduced significantly, but also saturated fat in the diet. Saturated fat in the diet would fall as well, increasing cardiovascular health. So again, a health benefit if we could get away from a high meat diet to lower on the food chain. And I want to wrap up by talking about the last sector, transportation and urban planning. And this is a study actually on obesity out of the Lancet last spring. They're talking about trends in BMI across 200 countries over a 40-year period, and there were 19 million participants. Unfortunately, this trend is going up all over the world. You can see men and women as far as obesity trends. And of course, part of this is food, but I would say another part of this is how we design cities. And if you look at cities in the United States, those with the highest walking and cycling for work commuting have better trends. They have 20% less obesity rates, 23% less diabetes rates when you compare the walkable, bikeable cities to those that don't promote, are not designed for walking and biking. And I think it's high time that we design cities for people rather than for motorized vehicles. I want to end with a quote from the Climate Summit in 2014. There was a health side meeting, and at our meeting, Acting Surgeon General Boris Lushniak made this statement. He said, "America does not have a healthcare system." People said, "What?" He repeated that. America does not have a healthcare system. We have a sick care system. And what he said is that we need to think beyond hospitals and healthcare systems, and a real healthcare system extends far beyond medical centers and includes safe routes to school, clean air and water, and flourishing, healthy communities. So this is something the Health in All Policies approach to, and everyone in this meeting, I think, understands this when we talk about community health and health in all policies. We know from epidemiologic studies, for example, the benefit of exercise, and designing communities that promote physical fitness could have huge health gains. I mean, look at, as you increase the physical activity, major risk reductions for cardiovascular disease, diabetes, depression, colon cancer, breast cancer. So we understand that link between exercise and health. And we're doing some modeling with an integrated transport and health model, asking the question, what if you increase commute time by walking? What would it mean for health? And this is just a case study, preliminary data showing that if you increased people's walk time by 10 minutes per week or 2 minutes per workday, that you would save $30 million in the state of Wisconsin simply by increasing weekly exercise by 10 minutes. So these are enormous opportunities. And right now, the current administration is talking about $1 trillion investment in infrastructure. What a golden opportunity for public health. You know, infrastructure is not just highways and bridges, it's bike trails and green communities and, and in fact, energy infrastructure and public health infrastructure and surveillance. So we do have a new administration, and their views on climate change are different from the last. But even at the federal level, when there's a lot of concern about moving forward with climate change, you have the U.S. mayors telling President Trump to recognize the urgent threat of climate change. You have the C40 Cities Initiative, megacities around the world, this is with Michael Bloomberg co-chairing this, that are moving forward to green environments. And this is where I think we really need to start thinking about pivoting to local leadership. That even if there is a slowdown at the federal or even international levels, there are huge opportunities at the local level. And we'll hear about a lot of these at this conference. So for example, leadership at state public health departments and in the healthcare system and in NGOs. We have CDC's Building Resilience Against Climate Effects, the BRACE program, Healthcare Without Harm, Kaiser Permanente, and the greening of the healthcare facilities. These are amazing initiatives that, regardless of federal leadership, are moving us in the right direction and moving us fast. Jeff Thompson is here to talk about his pioneering work with the Gunderson Health System, saving millions of dollars by going to clean energy. Linda Rudolph is here with the Climate and Health Alliance. And on Wednesday, there is a new, it's going to be released, the Medical Society Consortium on Climate and Health is bringing in big medical societies, including the AMA, are coming on board to talk about climate change as a health issue. So I'll conclude by saying that addressing the global climate challenge, the global climate crisis, through a low-carbon economy, especially across the energy sector, transportation, and food systems, can make us healthier and also save money. This is where I think doing something urgently about the global climate crisis could be the largest public health opportunity we've had in a very long time. So with that, I thank you very much.